Severe burning pain, the sensation of walking on eggshells, that's what life can be like for people with neuropathy. Our next guests say there's a safe way to stop the pain without the surgery. And here to explain, please welcome back Dr. James Ninh and his brother, Dr. James Ninh. They're joined by a patient who loves them almost as much as their mother does, patient Carol Etzel. Good morning. Good morning. All right, so before we get into this, I just want to explain some things. It's kind of interesting. Your parents were that generation that came to America after Vietnam fell, and here you are. They produced these two boys. We've got to name our boys. They named one Jimmy, one James. I didn't quite realize that Jimmy and James are kind of the same.
Right, you know, you can't make this story up.
Yeah.
You know, what happened in '76 is when my parents migrated from Vietnam, they knew absolutely no English. So we were blessed enough, we were sponsored by a Catholic church, and,
wow.
and I came out and I was named after Father James Hannon. About 18 months later, my parents knew about this much English and named him after the president.
Jimmy Carter. Yeah. So now we got Jimmy and James here.
Absolutely.
All right. We talk about diabetic neuropathy, which is one of those things that just so many more people are dealing with today because we know the rate of things like type 2 diabetes. Neuropathy can be caused by other things as well. So explain what's happening in the body when somebody has it.
So neuropathy basically is a disease of the nerves. And what I like to describe to people is you're basically a big supercomputer, the most elegant supercomputer ever designed. Mm-hmm. And what happens is the nerves are kind of the conduits which let your brain know what's going on. It says, hey, when I touch your foot, hey, someone is touching my foot with a finger. Well, when you have neuropathy, the signals get crossed. So when I touch your foot, instead of it saying, hey, there's a soft finger there, it says, oh, there are nails, eggshells. It's burning when there's nothing there. If I put a blanket over it, it says that it's scratching you, and it's just cotton. You know?
Yeah. And Carol, I know a couple of people who deal with that, and it's hard to explain the kind of pain that you have.
It really is. The point, you go through stages. It starts out with needles and pins.
Yeah, kind of when your foot falls asleep or something, and you feel
exactly.
that kind of.
And when in my situation, it was a bed sheet. If it ran across my toes, moving in the bed, I was just in orbit.
Excruciating pain.
Yes, very excruciating. Then it went from there to the little shocks. Your nerve endings were trying to get back where they belong.
Yeah. And
it would make little shocking feelings. Then the worst came, and that was when I woke up one morning and went to step out of bed, put my foot on the floor, and it was like I was stepping on rocks, very large rocks, painful.
Yeah, and in that case, if you can't walk, I mean, you don't want to walk.
You can't walk, you can't stand, your balance is gone, you have zero balance.
Yeah.
In fact, you were using a cane for a lot of times.
90% of that year I used a cane.
Yeah,
when we
wanted to
first
use a wheelchair,
right,
probably, yeah.
When I first started out, I did use a walker, but then I transferred to a cane.
Yeah, because oftentimes we think that people are using the walker because their legs don't work, but this was because they were so painful. What were you doing to address it? Did you know what it was originally?
Yes, ma'am, because I went to the doctor, a neurologist, and she ordered an EMG, and they ruled out diabetes. I had MS. In my earlier years, I had cancer, and they ruled out chemo treatments and said, it's got to be a virus, because I had just told them the week before that I had a severe virus.
Yeah. All right. So various causes, as we mentioned,
exactly.
for neuropathy. All right. So the normal way of dealing with it is what? Is it medications?
So traditionally medicine, what we've been trained to treat patients with is with medications, and medications are great. The problem with medications is that there's a lot of side effects. If you think of it this way, the medications are meant to kind of numb the nerves a little bit.
Right.
Well, you've got nerves in your brains and your arms, so you can affect everything. So what we try to do is use multiple different modalities to treat this. If you ever watch something like Iron Chef, they have chefs from all over the world, the different countries. So that's kind of what we do. We pull everything together using different strategies, physical therapy, blocks, stimulation, multiple ways.
Not every patient's the same either, so there might be different things that work for different patients. Okay, so literally it's not just about medication, it's not just about surgery. So he's mentioning some of those different things that you do.
Like Dr. Ninh said,
Like your brother said?
Right. Just like the Iron Chef, every chef has their secret ingredient, and everybody has their secret weapon. Well, what we're able to do is utilize each of those ingredients in our practice for the whole to make the patient better.
Because there's a chiropractic component here, too.
We utilize laser, which, you know, if you've had laser eye surgery, it's very similar concept. We're able to utilize the energy of laser to promote circulation.
Which sounds like science fiction to a lot of people, but I'm going to tell you, I had a shoulder that I had a tear in my delt, and they said, we can go in and do surgery, but that's going to create more scar tissue. It would wake me up in the middle of the night, that kind of excruciating pain that you talked about. Right. And finally I went to a chiropractor who said, let's use the laser. And I'm thinking, what's that going to do, right? But it literally opened up that scar tissue, got blood flowing, which is the oxygen that helps us heal, right? I've never felt it again.
Well, I'll tell you, the amazing thing is when you combine the laser with some of the medical treatment and some of the other modalities, we get an exponential growth and exponential effectiveness in the treatments.
The neuropathy in people's hands and feet is a little bit unique because unlike the brain, the nerves that are in your hands and feet, we call them the peripheral nerves, they can actually grow back sometimes. And what you want to do is you want to increase circulation there. You want to make sure they're in the right type of environment to grow with vitamins and getting the circulation. And we help bring circulation there. And not only that, but bring functionality back.
Yeah.
To them.
All right. Carol, how do you feel today?
I feel wonderful. Thank you. Talk to them.
The amazing thing is
the
real
don't
question.
Tell that.
We have more.
Is how long did it take?
That's right.
Yeah. How long did it take?
They did one injection and one laser treatment, and all my foot. On the left, my left foot's the worst. The right foot has just a little. But the left foot, it was healed from the tip of the toe to the arch. There was just a very small area in the heel.
But you're walking today.
And there's no cane.
No cane.
And there's no cane, no walker.
No cane.
And you're a fighter also. I mean,
yeah.
You're a fighter.
And it happened on the first time.
On the first time.
Right. The second injection took away the discomfort in the heel.
Girl, let's go
dancing. I'm ready.
Right, she's ready, she says. That is amazing. It's amazing. It's impacting so many more people in our population today. So to learn more about new non-surgical treatments for neuropathy, call the Spine and Osteoarthritis Center of Texas at 800-NEW4PAIN. That's 800-639-4724, 800-639-4724. You can also find them online at stopneuropathy.com. As simple as that, stopneuropathy.com. And the doctors have a special offer just for Great Day viewers. The first 50 callers will receive a free neuropathy screening. So get on the phone now and get rid of the pain. And you have an additional offer.
We do. And you know, Deborah, there's so many people out there that needs the care and in the state of the health care right now. Many patients don't have insurance. Right. So what we're going to do is we're going to randomly select one patient that needs the care, and we're going to let them go through the entire program and just do what we can to change their lives.
Yeah, get them back up and walking again. Thank you all very, very much. Okay, Carol, you and I are hitting the club tonight.
Absolutely.
We'll be right back.